Hi everyone, my name is Haley Leach and I'm a second year pharmacy student here at the University of Tennessee College of Pharmacy in Memphis. So since I'm an upcoming healthcare professional, I thought I would talk about an evolving technology in the healthcare field. The new buzzword in the field of pharmacy is adherence, and the FDA, so the Food Drug Administration, defines adherence as how well patients take their medications that's been prescribed by their doctors. So this can include even just dropping the prescription off at the pharmacy, actually taking the medication, or even taking the medication as they are instructed by their doctor and just simply following the instructions. But of the people who take chronic medications, so hypertension or high blood pressure medications, cholesterol medications, or even diabetes medications, 50% of these patients fail to take their medication as they're instructed. So this results in increased complications, possibly even death, and we've accrued $100 billion in healthcare costs associated with this medication non-adherence. So the technology that I'm going to be talking about with you today is the iPill, also called the intelligent pill, and it has been designed to combat this medication non-adherence with digital sensors. It's designed to be swallowed with water or with food, and then it travels naturally through the digestive tract. The pill can be electronically programmed to control drug delivery release at predefined criteria set forth by the doctors and teams of physicians. So current technologies out there are swallowable or ingestible microscopic cameras that can be used for diagnostic tools, but there's nothing that allows drug delivery once it is ingested with such a fine-tuned release mechanism. So this is where Philips Research Company has stepped up. So for example, some drugs are released better in acidic environments, so in the stomach, as to where other drugs are released better in basic environments such as the colon and further down the digestive tract. So one advantage of this intelligent pill is that the medication is released at a predetermined pH in the body. This eliminates erroneous medication absorption at unintended segments in the digestive tract. So when drugs are absorbed in the digestive tract, they can be systemically dispersed by the bloodstream to other parts of the body, and when they get to these other unintended parts of the body, they can also cause unintended effects known as side effects. So the use of the iPill and its specified release capabilities can reduce these unwanted effects of medication, and these could potentially result in decreased required doses for patients. So the technology of the iPill includes a micropressor, a battery, a pH sensor, a temperature sensor, a radio frequency wireless transceiver, the fluid pump, and lastly the drug reservoir. The iPill has the ability to communicate to a control unit, such as the patient's physician, via its wireless transceiver. And one of the videos that I've posted with my materials illustrates how the medication is released from the iPill. The iPill's internal pump, along with the micropressor, allows accurate control of the medication delivery, and the video shows bursts of medication being released at once. However, the iPill can be controlled to release a suspended release throughout the day, or it can release at multiple locations throughout the body in response to pH. So, in my opinion, this technology has the potential to be revolutionary in the healthcare industry, but there are going to be barriers to overcome when it comes to encouraging patients to take this pill along with their other multitude of other chronic daily medications. So some patients may be reluctant to take this pill basically because they are taking an electronic device and they're unsure what side effects that will have on their body, but potential benefits can be seen for the patient's outcomes and their medication adherence outside of the hospital. But I do believe that there is a segue into the hospital and inpatient side that the iPill can have for patients. So when patients undergo diagnostic criteria such as MRIs or CT scans, those diagnostic imaging tools can allow more of a fine-tuned, actual physical visualization of where the medication is in the body and can be controlled to release medications visually. And as I before mentioned, there is an associated $100 billion in healthcare costs due to medication non-adherence. And this intelligent pill technology will certainly drive down these costs, not only the non-adherence cost, but it can also benefit drug manufacturers. So when patients aren't taking their medications, they're not picking up their refills on time, therefore the manufacturers aren't required to make as much medication. So with this diagnostic criteria, Drug companies can be alerted of how much medication they need to make and how well that the physicians that are using their medication prescribes takes their daily regimen. So, in conclusion, I hope you found this evolving technology intriguing, and I hope that it stimulated or provoked some thoughts about your own health status and your own